Good morning or good afternoon. I'm delighted to welcome all of you around the world to this webinar on promoting early childhood development through combining cash transfers and parenting programs. This seminar is organized by the World Bank Group, Social Protection and Labor, with financial support from the government of Japan through the Japan Trust Fund for Scaling Nutrition. My name is Joan Lombardi, and I'm here in Washington with the World Bank team, and I'll be moderating this important session. We all know that the early years have a profound impact on the developing child, and that supportive and responsive parenting interactions with their children lay the foundation for long-term health, learning, and behavior. We also know that the stress of poverty and other living conditions can undermine efforts to provide for children and to respond to their needs. The paper we'll be hearing about today, which is the focus of this webinar, speaks to both of these issues. It focuses both on responsive parenting, which is a key aspect of nurturing care, and the enabling environment, so important to support strong families. We have three speakers today. First, we'll hear from Laura Rawlings, the lead social protection specialist at the World Bank, who is an economist with over 20 years of experience in the design, implementation, and evaluation of human development programs. Next, we'll hear from Julieta Trias, an economist with the global practice, social protection, and jobs at the World Bank, with a broad set of experiences with impact evaluation and early childhood development. Finally, we'll hear from Melissa Zumaeta, who is the World Bank consultant with experience in the design and implementation of child development interventions and direct involvement in technical assistance to a number of countries around the world. Before we get started and I turn it over to Laura, just a reminder to submit your questions to the panelists using the chat bar. You can simply type them in and we will be passing them along to the panelists. You can also follow our live coverage on Twitter. So let's get started. I'm very excited to turn this over to the panel for this very interesting webinar. Laura?
Thank you so much, Joan. It's a pleasure to be here, and I just wanted to let all of you know that three of the co-authors of this paper are here, and we're delighted to be presenting. And also thank you to Joan and to socialprotection.org for being with us and for hosting this. But I wanted to recognize also Ana Maria Arriagada and Jonathan Perry, who were our collaborators on this work. And the full paper and a shorter version are available. And I think that information has been shared with you. If not, you can find it through the World Bank. So it's a real pleasure to share this with you. This work that we've been doing brings together two worlds, the social protection world and the world of early childhood development. And the work that we have done really complements quite a bit of literature that looks at cash transfers and efforts primarily around nutrition, and there was not as much around parenting. They're obviously both important, and we'll talk a bit about both, but we focused more on the parenting because there was a gap in the reviews of the literature there, and it's critical. I want to pick up a bit where Joan left off, which is to focus on the importance of investing in children's early years. And this is particularly compelling because it combines a lot of evidence, a lot of scientific and economic evidence, along with a very compelling focus that I think many of us feel, and that's based in a lot of legislation, a lot of rights on the importance of investing in children. So in short, it combines the head and the heart to provide a very good rationale for these types of investments. And the reason that investing in the early years is important, if we look at some of the scientific literature, and on the left you'll see a stylized depiction from Charles Nelson's work from Harvard Medical School and the Center for the Developing Child, that shows neurological development in a child's brain. This is a depiction of a child who's approximately 3 months old, and the brain is extremely plastic at this point and developing very quickly, and there needs to be appropriate nurturing care for children to develop properly, especially and including in the cognitive areas. And a lot of the neuroscience and evidence coming out of neuroscience points very clearly to this and to the importance of the window of opportunity, which is depicted on the right-hand side from a seminal piece from Neurons to Neighborhoods that shows how starting in utero, but really through a child's first 1,000 days, and in fact beyond, you have this window of opportunity for development around sensory pathways, around language, and around higher cognitive function. So much of the cognition, much of the capacities that will develop and provide a foundation for future human capital development are in fact established in early childhood. And then this is complemented by a lot of evidence, excuse me, in the field of economics, famously again from Jim Heckman, a Nobel laureate who's done quite a bit of work in this area, and that shows that the rates of return to investments earlier in a child's life are much higher than investments later in life. And so we see here the rates of return in the age range of children 0 to 3 and programs that target those children, programs for around the 4 to 5-year-old age range, school-age children, and then usually post-secondary schooling, so around job training. And here what's important to note, at least through the school-age years, is that the rates of return are orthogonal or opposite to the financing that actually goes into these types of programs. So there is a very important policy agenda here to mobilize this evidence and to show the importance of making these investments early on in a child's life. And the third reason why it's really important to invest early is because this brings us quite squarely into the social protection area as well, is that it's very important to combat the inequalities that manifest themselves very early in life. One of our ultimate goals as development practitioners, but also those of us who have a particular focus on the extreme poor, as is often the case with social protection, is to not only address immediate poverty, but also address intergenerational cycles of poverty. And these distinctions start very early on in terms of deficiencies that are more concentrated among the poor. So here we have two illustrations of that. On the left is stunting prevalence in children under 5, comparing the lowest wealth quintile, the poorest in the country, and the highest wealth quintile, the most wealthy. And we see very large differences in most countries in terms of the stunting prevalence rate. Another indicator is just some data from the Central African Republic that show that early in life, the differences in children with a very basic cognitive skill of being able to recognize 10 letters of the alphabet starts to diverge quite a bit between the richest and poorest quintile, even starting out at age 3, but then increasing as a child gets older. So what this points to is the importance of investing early, and the importance also of keeping in mind an equity and poverty focus to those investments. So we can talk a bit more about it if you're interested in the questions and answers, but I did want to point to a critical new initiative that we have here at the World Bank, which is the Human Capital Project. And one of the elements of the Human Capital Project, the first pillar is the Human Capital Index, which really is a measure of the future productivity of a current generation in a country, holding constant, if you will, the investments that are made in human capital today as measured by survival, children's survival who don't grow up to become future workers, school, a very important metric, which is not just years of schooling, but quality adjusted years of schooling, which looks at how much children are actually learning as opposed to what grade they have attained, and a measure of health that combines adult survival with childhood stunting. And these measures combined provide a human capital index, and we have now covered most countries in the world, developed and developing, with the Human Capital Index. And so countries have a score between 0 and 1. No one has a 1, no one has a 0, but the global average, I believe, is around 0.6, and then the average in certain regions, such as Africa, is around 0.4. And what that would mean, for example, in the case of Africa, is that with current levels of human development, this generation is achieving only 40% of its potential were full investments in health and education as metrics for human capital made, and those that capital fully realized. So this is the World Bank's framework for the early years, and it is very similar to the now well-known nurturing care framework, and essentially rests on 3 pillars. The first being the importance of good health and nutrition, particularly in the first 1,000 days of life that we just looked at with the window of opportunity, and this would be a lot around maternal and child health, and also nutrition sensitive and nutrition specific interventions. The second pillar is around early stimulation and learning. So this is not just preschool, but really the importance of investing in positive parenting, really from the very beginning of a child's life. And last, but particularly for us, certainly not least, is the importance of nurturing and protecting children and families. And this is important because we know, as Joan was mentioning, that there are important stresses associated particularly with extreme poverty, associated also with families and children who are in fragile conflict and violent settings. And this is where where I know a lot of you work in the field of child protection really also speaks to what the work that is being done in social protection, which often has a focus particularly on the poor. And as we'll see in the next slide, our work in social protection and as a community working in social protection is actually relevant to all 3 of these domains. So I want to walk you through this just a little bit before turning to Melissa and then Julieta. So many social protection programs, and in fact cash transfers specifically, often target both the poorest households and households with younger children. So many cash transfer programs are designed to be child sensitive. So there's a great deal of work in the cash transfer field that is highly relevant to families, particularly vulnerable families with children. And from really their inception, these cash transfer programs have been multi-sectoral, and they have often sought to not only relieve short-term poverty, but also build human capital through enhancing access to education, nutrition, and health services. And this has now been dubbed in many circles kind of the cash plus agenda. So it's really about more than simply delivering cash, but not to underestimate the importance of those income support contributions. And there's also been a traditional focus in the cash transfer field on behavior change, particularly behavior change among parents for promoting human capital. And a classic example of that is really a lot of the first generation of cash transfer programs that were introduced in Latin America in the 1990s that focused on introducing conditional cash transfers to encourage parents to take their children to well baby checkups and also enroll them in school and ensure adequate attendance. So this is the theory of change that you will find in the paper, both the short version and the longer version. And we just want to spend a few minutes to walk through here what is depicted when we talk about cash transfer programs and how they can improve child outcomes, particularly when you have this cash plus agenda. So on the upper part of the theory of change, in the blue, we have the provision of cash itself, which will increase financial resources for households. This is often targeted, as we had mentioned, to the poorest or most vulnerable households. And this income support can increase parental investments in children, such as the purchase of food and shelter, and also investments directly for child cognitive support as well, such as purchasing toys or supplies for early learning, and importantly can also break down barriers through the income, demand-side barriers to accessing some of the available services, particularly schooling, health services, and nutrition. It can also lead to decreased depression and emotional stress. There's literature and evidence coming out on this that will give parents the mental space and maybe less of the direct pressure of having to make ends meet every day to be able to provide more nurturing and responsive parenting. And these clearly have important outcomes, as Julieta will discuss in just a little bit. And increasingly, the cash transfer programs are now being delivered with accompanying measures, which cover a range of interventions, both from incentives to use available services, for example, health and nutrition and schooling, but also cash transfer programs are often now directly providing information or goods and services relevant to investments in children, particularly young children. So we'll go into that a little bit more in a moment, but what this can do is increase access to available supply-side services that are very important for addressing poverty and for child development outcomes, and also increase parent and caregiver access to skills and training and allow them to incorporate this in their practices. So in looking at the outputs, looking in the changes of behaviors, you can see that children, as a result of this, can have more contact with health, nutrition, early stimulation, and learning, and parents can start to adapt and apply, very importantly, improved behaviors and practices around child rearing. And these can lead to very important impacts, as Julieta will cover, in terms of children's human capital. So briefly, we can put the accompanying measures in the Cash Plus agenda into two main buckets, one around parenting and one around nutrition. The nutrition area, which our paper doesn't go into as much, but there's quite a bit of literature if you all are interested in that, and we can talk about that and point you to it if you're interested. But it involves some nutrition-specific areas around micronutrient and macronutrient provision, nutrition education, very often around the importance of exclusive breastfeeding in a child's first 6 months of life, and importantly also how to transition into solid foods with complementary feeding, and also the importance of dietary diversity. So a lot of nutrition education. And then also there can be education around water and sanitation, a lot of important investments around maternal and child health, and encouraging access to clean drinking water, sanitation, and practices there, and even sometimes it's combined with food supplements or biofortified food. The parenting interventions, which are more the focus of our paper, look at services that are provided that can enhance parent-child interactions, knowledges, beliefs, and practices. It can cover a range of topics from nutrition, health, and hygiene to child stimulation and positive parenting, and can be delivered through a range of interventions. And this can include home visits. It can include community-based meetings. It can take advantage of existing services such as the primary healthcare network, or it can use a combination of these. And we go into this in more detail in the paper, so I won't go through everything that we have here on the slide, but just to note that there are pros and cons, as with all choices, in terms of home visits, community-based meetings, and using the health center visits to provide these complements. Home visits primarily allow for tailoring. You're visiting the home, you can understand the household context, you can tailor those interventions to the children and the family members, and there are some very good models of Cash Plus programs that focus on this, and importantly, you can have direct outreach to marginal and vulnerable households, so you can do some direct targeting. The trade-off is that it often will call for much more, a wider range, I should say, many more skills in terms of the interventionists themselves, because they're working in the household context. They need to be prepared to look at a range of issues and not just exclusively looking at child development, but especially if they're working with vulnerable families, other issues can come up, substance abuse, domestic violence, other constraints that the household may be facing. And so really, with duty of care, people need to be prepared to know how to handle those situations. And clearly, home visits are generally more expensive, right? You're displacing people to go directly to the homes. In terms of community-based meetings, these can be very powerful. They are at a lower cost, which can be good. You can have economies of scale, and importantly, you can encourage peer support. And there are very interesting results coming out of, for example, out of India, some of the work that Aurazo and his colleagues are doing that point to the importance of peer support in these groups. Also coming out of Madagascar, where mother leaders are formed to support each other and support some of the parenting and child development practices. And it looks like there's a value added, if you will, in some cases in terms of the outcomes achieved through this type of peer support. You can also combine the group meetings with leveraging often other community resources, which can be valuable. The cons are that it's more difficult to ensure that interventions are tailored to the needs of the children in the household. It obviously relies on parents to come and to show up, so sometimes those have constraints around that are less able to come, and you sometimes have to develop a wider curriculum that's less age specific depending on how it's structured. Using health center visits can be very powerful, particularly if that is a big part of the cash transfer program to begin with, when families are either required or strongly encouraged to take their young children to health center visits. And often there's a bit of downtime there in any case that can be taken advantage of in terms of being mindful of the demands on parents' time, which anyone who's been a parent knows is considerable. And so there you can sort of get a 2-for-1, if you will, by taking advantage that the parents are at the clinic, and you can often take advantage also of trained professionals being available. But it depends on access to health centers. You need the cooperation with the health sector. Usually the staff that you're going to be relying on already have a full-time job and might not be as amenable or available to providing some of this additional support. And again, you have the problem of access for some of the more marginal groups. So I think now I'm going to turn to my colleague, Melissa. Over to you.
So hi, I'm Melissa, and I'm going to make a brief summary of an analysis that we made for the paper, in which we revised in depth 10 not necessarily conditional cash transfer programs that included parental intervention in their implementation. And these 10 cases cover different regions in the world and include both conditional cash transfers and unconditional ones, especially in Africa. And we provide actually a proposal on how to classify them. This classification is based on, well, it has 4 categories and is defined around the relationship by which the cash transfer and the parent intervention is designed and delivered. And we found 2 very common types of relationship between the cash transfer and the parental intervention. The first one was the integrated model, in which the parent intervention is managed directly by the cash transfer program, and we found this case in Bangladesh, Colombia, Burkina Faso, and Niger. Another common arrangement that we found in this analysis was the one that we call managed convergence, which characterized as different agencies of actors that explicitly coordinate efforts to bring the cash transfer program and the parental intervention to the same population. This means they have a written agreement, or they have a committee that actually coordinates explicitly in a established space to intervene to have the same target population and attend the same population. A third, less common model, what we call alignment, is characterized by a cash transfer and a parenting program that do not explicitly coordinate with each other, but deliver interventions to similar, if not the same population. And that's the case of Peru, in which, interestingly, the cash transfer and the parental intervention, which is called CUNAMAS, are implemented by the same ministry, but there is no explicit coordination between those 2 programs. They do target the same districts, so geographically they are attending the same populations, but the targeting of families themselves have a different algorithm, so there's some difference. And finally, another type of model that we found in the analysis, we call piggy-backing, is an interesting one in which the cash transfer is delivered through a separate established platform that is already existing in the country, such as a primary healthcare network. And that healthcare network is, for example, delivering the parenting program. And this is the case of Senegal, in which the health services were already delivering a parenting program that was reaching the poorest, the families with younger children, and the cash transfer built on that and start providing the cash. Based on that analysis and also on literature review that we revised around parenting and implementation of cash transfers, we are proposing 4 big issues as lessons learned for the implementation of cash transfer plus model. They are related around content, delivery, workforce, and basic building blocks. And in terms of content, this is more related to the parenting part of the implementation. And the most important conclusions are that it is important to tailor the content to the child development stage. So just general content is not as effective. Then you need to take into account the cultural relevance and the situation of the possible situation of conflict or disaster. Also, the target intervention should target not only mothers, which is the case in many circumstances, but also parents or caregivers that are involved in the care of the children. They also need to include something that is more interactive, demonstrations and practice, and probably receive some feedback during the training session. Also, it's important that the CT Plus include a delivery system that invests in strong protocols and ensure that the material has fidelity. Then strength social support among participating parenting, so like groups of parents working together. You should, like in the case of Senegal, build on existing platforms that already are working well in the country. And the third type of lesson is around the workforce, which is a very important lesson, especially for the field. You should ensure adequate workforce training with access to necessary material. Also take into account the pros and cons of paid versus voluntary work, and sometimes, especially for the delivery of the parenting intervention, voluntary work can bring about people with more commitment in the issue. You should also consider financial and non-financial incentives like recognitions or providing uniforms. That kind of non-financial incentives have also worked in the field. You should also take into account the pros and cons of using professional and paraprofessional workers, not necessarily the soft skills needed to convince parents on behavioral change are related to professional, and if you put that as the minimum requirement for education, that will bring better results. And you should establish a frequent and supportive supervision scheme, including on-the-job training and coaching for field staff. Finally, also around implementation, it's important to consider the basic building blocks of the intervention. You should start intervention with a solid logic framework. So invest a little bit of time at the beginning, thinking around the logic change and the results that you're expecting from this intervention. You should invest in a monitoring and evaluation system that assures some quality assurance and identify the most effective modalities, not necessarily just by the end with a very costly impact evaluation, but like also during the implementation. And then you should manage performance against standards of quality that you should establish at the beginning. So these are the 4 types of lessons learned that we are highlighting as important for implementation. But I'm passing to Julieta to give us a sense on the impacts.
Thank you very much, Melissa. So now after that, Laura gave us a nice theory of change on how this cash transfer and the accompanying measure could improve children outcomes, and Melissa walked us through like the different ways that we have a combination between cash transfer and parenting intervention. So now what I'm going to do is to discuss more what we know on these cash transfer programs from impact evaluations in terms to improve the children outcomes, and where the evidence is stronger and where we need to build more evidence. So what we did in this paper is we went through the multiple literature review around cash transfers, and what we have like that strong evidence is that we know that these cash transfers are very successful to reduce poverty and also to increase the use of health services. And then when we move to the children outcomes, there we have like this is a more indirect step. It's not like the design of the cash transfer, especially at the beginning, it was like with the objective of reduce poverty and when they have accompanying measure for with the conditionalities for attending to the clinic. So then they were targeting actually that, looking for improvement in those behaviors. So on that part, we have been successful. Then on the second part, like we have that those effects sometimes have translated in impacts for the children, and one of the effects that we can see in many cases is a reduction in illness. We have also cases where there is an improvement in nutritional outcomes, like stunting and wasting. And then we have cases, and here is where the literature is thin but is growing, is around the improvement in children's cognitive and language skills. So here is where we really need to build more. We know, like from the very few evaluations that are measuring these outcomes, we have that some of them are finding like positive impacts on these skills. So that is pointing to an important aspect to try to explore with the cash transfer and with the company measure, because this will have like key impacts on the long-term human capital accumulation. So in addition to this effect on the children, it's also important to look at what is happening in the environment, in the household environment where the child is raised. So we look at what is happening with the mother, especially the part of maternal depression and stress that, of course, will affect a lot how she's able to take care of the baby and the skills that that baby could develop. A depressed mom may be less effective in providing that stimulation than a mother that is actively engaging with the kids and promoting on a daily basis and on each activities the developing skills, like with language and with cognition and motor skills. So what we have, like from, again, some evaluations that are measuring maternal depression and stress, is that some of them, like in the case of Mexico, are pointing to improvements in a reduction in maternal depression and stress. And this will be key also to try to boost those children's outcomes. So these are more effects in the short term. Then if we look at effects in the long term, we have evidence that points to the impact of shocks early in life. So what we have seen is that kids that are in the cash transfer programs, when the shock happens, the kids that are in the program are able to have better outcomes later on than the kids that were not receiving the cash transfer. So here is where we have an important mitigation effect, and especially as Laura was showing us how effective are the programs in the early stages where the brain is developing. So if we can minimize those negative impacts, then that will have like a strong impact in what happens later in life, and we have some evaluation looking at education outcomes and then labor market outcomes. So especially in this review, as we were discussing in the beginning, we wanted to focus on the part of the cognition that is where the literature is seen and we know less, and we really want to explore how the programs are working, what's the design, and what a company measure could help us to improve those outcomes. So I have on the right-hand side of the screen a graphic with some evaluations from LAC, where they were measuring cognitive skill, language skills, and in some cases they were measuring also motor skills. And we are seeing that there are two domains that are coming as important domains, the cognitive and the language. We have here examples of several cash transfers that are having positive outcomes in those domains. So then let's say that, well, we have this initial promising impact. So now let's look at the company measure what we know about how effective they are on improving these outcomes. So what we did is we went and checked other literature reviews, and what I have here in the screen is a comparison between parenting interventions that provide, that teach parents how to play with the kids and how to promote parent-child interaction. And what we have is that the average effect on cognition from those interventions is around 0.42 standard deviation. So this is a quite large effect, and if we compare with other interventions that are not focusing on the part of like building those cognitive and language skills, so if we, for instance, we look at the nutrition intervention, and here we have a mix of intervention that provide macronutrients, intervention that provides parental training around nutrition, we see that these interventions are effective, but the effect is smaller than the other interventions that are actually targeting the part of the social stimulation. So in that comparison, the effect is around 0.09 standard deviation versus 0.42. If we think in the other way around, we have that these nutritional interventions are much more effective to improve the nutritional outcomes, but then, as we would expect, and if we look at parenting intervention for social stimulation and say how much, what's the impact that they have on nutritional outcomes, and we will see, well, there is no effect on this. So then, basically, the message here is like if we want to improve these cognitive and language skills, we need to also think in the interventions that are directly targeting those skills. So that was more the evidence looking at the first years, the window of opportunity. But what happened now if we think in the long term, not in the short term, what happened many years later? So we have one of the most famous home parenting program is the one from Jamaica, from Sally McGregor. And what they did is that, like more than 20 years ago, they ran an experiment to compare with stunted kids, most of them stunted kids, what happened if the parents receive a stimulation, like a training on child stimulation, if the parents receive a nutritional supplement for the kids, and if those households were receiving both stimulation and nutritional supplement, and they also have an experimental control group to be able to measure that effect. And what we can see in the graphic, if we compare the bottom line, that is a control group, with the line of stimulation and nutritional supplement, is we can see that after 24 months, we have a positive effect in terms of cognitive outcomes. So this is one of the precursor examples that started with like raising the point that doing this kind of parenting intervention will help us a lot in order to improve cognitive outcomes. And at the same time, if they also track kids that were not stunted, and that's the top, the line on the top. And if you compare after 24 months, you can see that there is a nice convergence between the non-stunted kids that were not receiving the program with the stunted kids that were receiving a stimulation and nutritional supplement or a stimulation. So that is a nice way to have like trying to reduce the gap that start very early in life. And then more than 20 years later, these kids were followed during the primary school age, secondary school age, and now in the labor market. So after 20 years, the kids that were participating in the programs have larger earnings than the other kids. So we have, like, if we look at full-time workers, we have that the earnings are 25% higher than those kids that were in the control group. So now it's like this evidence was coming from a small experiment. That experiment was with 129 kids. So what we want to know is, like, this kind of intervention have a potential, but what do we know if we try to take those interventions up to scale? With all the challenges that have to working up to scale, where the quality will not be the same, where we cannot, like, control the environment in the same way that in a small experiment. So that was our, like, key focus on this review, like try to look at impact evaluations that have a component on the cash transfer, and we're able also to pick separately the impact of adding parenting to the cash transfer program. So two of these programs are actually based on the same curricula than the Jamaica program. So the Colombia and Peru are based on the reach up model. So after the Jamaica, the team that build the curricula for Jamaica then keep working like multiple years with and experimenting more, and then they prepare a parenting curriculum that could be used for other home visiting program, and that is called the Reach Up and Learn program. So the Colombia and Peru took that model and adapted a little bit to the context of each of the countries. And in the case of Colombia, so they what they wanted to do is they wanted to test one is how they could work at a larger scale, where instead of having 122, in this case they were having like around 1,500 kids with receiving the program, and they wanted also to use the platform of the cash transfer to see where they could scale up the program using that platform. So they used the Madres Guías as the person that was going to visit the household to provide that parental training. So this program was in the same case as in Jamaica. It was 1 hour per week, both in Colombia and in Peru. And what we have when we look at the impact on parental practice, like we are trying to change the behavior as a parent and have the parents that are doing more activities with the kids. So what we have from Colombia and Peru is that improve the parental practices, that is a number of play activities and the play material that the kids have, and the program have a specific area where they were teaching the parents also how to build their own team using recyclable materials. So we have that first link, like this is to change parental behavior, and we have this positive impact on parental behavior. And then when they look at the impact on child development outcomes, they found improvement in cognition and in language. However, like this doesn't mean that we can have this effect in the short term, but then in the longer term, it's more like a question where those effects could sustain, or there is a need like to keep other like services in order to keep that initial initial improvement. So for Colombia, they were able to do a second follow-up, and in the second follow-up, while the first follow-up have like improvement in cognition in language, 2 years after the program, those effects fade out. So that points to an aspect as, okay, we need to consider on this aspect in the short term, but we may need to consider more things in the medium and longer term in order to keep those effects constant. And then there are other two cases that you can see in the paper. So one is with Niger, where they instead of using 1 hour per week, they did the home visit once per month, and they add the group meetings. This was on a much larger set of beneficiaries. So that's the challenge on reducing the frequency, because it's very hard, like if you have too many beneficiaries, like to be able to visit them every week. And in this case, they use the curricula from UNICEF on essential family practices, and they also developed their own material to adhere. And this was much more than a parenting on child simulation. These have like 13 different things going on. So what we saw from that program is that that it didn't have effects on cognition and on language, but it has effects on how the parents were on the parental improvement in terms of nutritional practice, on exclusive breastfeeding and complementary feeding, and also have impacts on harsh discipline. Here is like we don't know why this didn't work as in the other cases, but there are some things that we can think, like the kind of broad and very general curriculum that was taking many different things into account with one visit with one meeting per month. And the second thing is in terms of the so in terms of how much these families could process when you are mixing that. So there was no effect there, but that doesn't mean that this could not have effect. So maybe it's more like how we can design the program that we really focus on that and we leave enough time for the parents to process that information, to practice that information. But an interesting result here is that program reduced harsh discipline, and that's maybe also connected with a positive impact on social-emotional skills. That is another area that we want to explore, and this is very infrequently measured, so we don't know too much. But with this, is something that if the program is focusing on improving the parental practice on harsh discipline, this will be something that you want to track and measure to see what's the impact. And finally, in the case of Mexico, in this case, they work specifically on group meetings, and here they have a model where the cash transfer was doing the part of the cash, and then the Educación Inicial was having, initial education, that the CONAFE was having that program for families that were in rural areas and did not have access for preschool. So then, in order to compensate the lack of early stimulation for the kids, because there was no preschool available, they introduced this parental program so the parents could provide the stimulation. So this was done through group meetings, and that was also a weekly meeting. So we don't know what was the impact on parental practice, because this was not measured, so we don't know how this translates on parents being more active with the kids and having more play activities. So this is very important, like when you are doing this kind of program, to try to measure that. But what we have observed is a positive impact also in cognition and language again. And this was coming especially from, they have different arms, from an arm that was promoting the participation in the parenting meetings, not just offering, but also it's offering and promoting that the parents should go. And in some cases there are anecdotal information saying that the parents were attending because they saw that it was kind of conditional. So now to finalize, some key message coming from the presentation is that we really need to start early, because it's where the brain is more plastic and is developing. So there is where we have the opportunity to close that inequality gap, and it's where the kids, where we have more productivity in terms of how much we can affect the cognitive and language skills. Then the second one is that with this cash transfer, we may have a comparative advantage, because if we compare with other sectors, the advantage that we have is that many times these cash transfer are focused on the poorest, and we are reaching the household with the poorest, where we have the largest deficit. So then this is a way that we can effectively work on the outcomes of the children that have the largest disadvantage. Then the third one is that the cash transfers have already shown that we can increase the use of services, the health services for pregnant women and for children, but also we can use this cash transfer also to increase other services that are needed. We have evidence that this program has been successful to improve nutritional, health, and child development outcomes in many cases. So now it's more thinking in what's accompanying measure to help us to boost those results. And here in this presentation, we wanted to bring the parenting intervention where it has been less frequently used, and we have to learn much more on how to bring the evidence that is coming from control studies to a larger scale, and how to do in a way that can be scalable and realistic in terms of cost. And finally, we gave you a summary on the 4 models that we observed from the implementation, where we have the integrated model, where the cash transfer is doing everything, the managed convergence, where two firms work together to provide, the cash transfer program and other program, like in the case of the Mexico, the Progresa with the Educación Inicial, work together to provide a service. Then the alignment program and the piggy-backing program, that is more the other sector providing, for instance, the parenting, like a health sector providing the parenting, and using that entry point like to provide the cash transfer. So here we have, we wanted to like cover all this in on how we can use these cash transfer programs and bring measures that are less frequently measured, accompanying measures that are less frequently used in order to boost those child development outcomes.
Great. Well, thank you so much. We have just time for a few questions. You presented a tremendous amount of material, and I think that the listeners will be able to integrate that into their own situations as they read the report. But I want to step back for a second and ask Laura, you've been tracking this for a long time. What changes have you seen in people's belief that we can use the cash transfer system to promote child development?
Well, I think we've seen a lot of evolution in the cash transfer space, particularly I'd say over the past 5, maybe 10 years. So not only have we seen, first of all, a tremendous growth in the coverage of these programs. They've now been adopted in the majority of countries in the developing world, and they're growing in terms of coverage. But we've also seen that there has been quite a bit of variation in terms of their design and application, and that's where we see, as we saw in the presentation in the paper, a lot of the cash plus agenda that comes in. So there, I don't think in most, at least large programs now, some of the smaller NGO programs don't have these accompanying measures, but most programs do have accompanying measures, and a lot of the cash transfer programs remain targeted to families with young children. So it's what we emphasize in the paper and what came out, and Melissa and Julieta were emphasizing, that these programs provide an opportunity, unlike many others, to reach poor families with young children where those human capital deficits are concentrated. And what we see from the literature and what Julieta presented is that even in and of themselves, the cash and the cash transfer has an impact in these domains, but the potential for having an even greater impact from the plus combined with the cash is very much there. And I think what we've seen is that they're being applied in a wide range of contexts. So a lot of the challenge is to see how can the programs be adapted through design, through being sensitive to the context in which they're working, to make sure that you're providing not only the income support, but those investments in human capital.
So what you're saying is the cash transfer systems are a platform that we can use to promote further child development outcomes. Is there any controversy to that notion of conditionality?
Well, there's a lot of debate around conditionality. I think what's important to recognize here, and I would invite my colleagues to weigh in, is that it's a little bit of a false debate, because often the so-called unconditional programs have very strong framing in terms of what's expected from families because they're receiving the cash. And then the conditions range, and conditional programs range from being strictly enforced, and frankly that's fairly rare in a lot of cases, to more soft conditionalities. So it's framed as a conditional program, but the condition being withdrawn, if you will, or the cash being withdrawn because conditions aren't met, usually even in those where it's very strictly monitored, wouldn't kick in until there's been a real problem and an attempt to address it. So I think what's important to recognize in the conditionality debate is also the fact that very often the conditions are put forward from a policy perspective, that there's a resistance to hand out something for nothing. And so governments will often, and this is true in the public programs, will often frame it that, okay, the family can receive this, but in turn we have some requirements. And I think this is quite clear in some areas where you have conditionalities, for example, around primary school enrollment, but enrollment rates are already practically universal.
Well, that's a changing sense of what these cash transfer programs can do. Melissa, you mentioned 4 models. Of those 4 models, is there information in the literature to tell us which one works best?
And there's no real impact evaluation for the 4 models that we are proposing here, so we cannot actually say that one works better than the other one. But there is some issues that you have to take into consideration if you want to implement these models. For example, if you are thinking on you're the cash transfer and you're thinking on implementing this parent intervention, and your first thought is, okay, I will do it myself, you have to take a breath and think, what are my capacities? Can I actually pay larger staff to do this implementation? Is this manageable, etc.? Also, you have to start thinking, what is the parent intervention that I want to do? If it's, for example, a home visit, this is a very time-consuming type of intervention, so maybe it's not in your best interest to implement it yourself as a cash transfer program, but to align or, like in the case of Mexico, have a clear coordination with other agencies that have this expertise. And also, for example, just telling about the advantages of all the apologies, Senegal worked from something that actually was being successful, reaching the children under 2. So it also had an advantage. They work from something existing, from something that was already working and that was reaching the population that they want to. So there is no magic recipe. All have pros and cons. And we still need more information from impact evaluations, as Julieta was mentioning. There's some impact evaluations that especially in the Latin American countries, have estimated impacts, but we don't have a lot of information to actually have a clear answer to that question.
I think that's the key, and one of the questions that came in was about implementation. Do we know we have impact outcomes, but do we know anything about implementation issues as we scale?
Yeah. That is where like when we are thinking in this model, we need to try to combine not only with the impact evaluation, but more like a process evaluation to understand why this program is having impact and not the other, what is different in that implementation, what are the challenges that they are facing that could be connected with the result that they have.
Yeah, I think one of the comments that I think we always hear is the match between your goal and your outcome. And I think you're pointing that out is really important. If some of the listeners want more information or they want technical assistance as they think through the issues, where do they go?
That's a good question. I think there's a lot of experience out there, and increasingly we're seeing the value of not only having the evaluation results and understanding this, and as Julieta was mentioning, the impact evaluation as well as the process evaluation. So, sort of a first point of entry is this emerging, not just emerging, there's now quite a lot of literature that goes beyond, that has the impact evaluation evidence, but also a lot of cases that are out there about how this is done. So that's one area. We also see a lot of, and as a case in point, just 2 weeks ago, there was a community of practice among Francophone countries that have cash transfer programs that are using accompanying measures, and 19 of those programs came together to exchange information and also see what was going on. Madagascar hosted this, and they're doing a lot in this area. So I think the more those peer-to-peer learning and South-South exchanges can take place, that is important as well. So it's something that we try to support in the World Bank, but you also have a number of groups, and in fact, socialprotection.org, and a shout out to them, participated in the program in Madagascar, and you see UNICEF doing a lot in this area. There's a lot going on, and I do want to point to important platforms like socialprotection.org, where you have material and can share information. And then at the World Bank here on our own websites, we have quite a bit of information and are often working with governments and particular programs to provide not only financing but technical support as well.
Yeah, I think that's going to be, having these learning communities is going to be critical because so many questions come up. Julieta?
Yeah, and I wanted to add, so we have like two versions of this paper. We have a long paper and a brief paper. So there are like a lot of information or resources that are available, like for instance, which curricula or curriculums are available for parental intervention. We have links for the Reach Up or Care for Development and other programs. If you are interested in measuring child development outcomes, the bank has also a toolkit on how to measure child development outcomes that goes from which are the measurement available, how I choose the measure, how I adapt it, and how I implement it on the field. So that is a quite useful resource. We also have the link there. So our paper is also trying to combine different resources that may be needed when you are trying to design a program that has the cash transfer with the parenting. We have a lot of evidence there summarized on parenting intervention and pointing to different cases, and also like trying to kind of structure what were the different design features that were included in the.
That's the key for us to be learning, right?
So they are like, we were like in one part summarizing all the different features and comparing, and also Melissa, when she did the review on the 10 cases from the bank, was also like focusing on all those different
aspects of implementation.
And we have a link in the paper to an annex that includes all that information from the cases, and also a framework that you can use for other.
So this paper is really a resource for people, and I think we've had, as you mentioned, a lot more information about the integration of nutrition. This is a new plus, right? So any final recommendations for people who are just beginning to think about this as we close this webinar?
It will require like a real consideration on what is the context where you are working. There is no one solution. So it will be more on trying to tailor to the context, but taking into account that quality could make, quality of the implementation could make a difference. So how to, especially when they are adding these parenting programs, how to set up a good monitoring system that could help us to keep that quality going through the program, have a good quality and maintain it through the program. So that's really important, because we have many parenting programs that we see that they have no impact, even in a small scale, that we don't know too much on the implementation.
We don't know if they were actually implemented.
Yes, so we don't know how it was implemented, what was happening in the household, or what was happening in those meetings. So I think that the key to be able to move forward on the knowledge part will be to really try to disentangle what are the key aspects of implementing this program.
Good advice.
And aligned to that, I think a very important aspect that we found in the revision of cases and the literature is to invest in the field workforce. This is a massive workforce that you're adding to your implementation, and sometimes it's overwhelming, but that's the key to success, like to change behaviors, how they interact with the parents. Parenting in general is more of a personal type of decision, so you need to find also people that have soft skills. You don't need necessarily super professionals on the issue. You need somebody that actually can convince the population, people that is local, knows the culture, etc. So invest in the workforce, invest in having equality also, and accompanying of this.
So they're key to the implementation process.
Yeah.
We'll build on each other. Laura, final word.
Okay, my final word is take advantage of the opportunity. These programs are growing. The cash transfer programs are reaching a very, very important target population, and often families with young children where there's an opportunity to provide not just income support, but really invest in their futures. And while you're taking advantage of the opportunity to invest there, learn more about it, especially about how these combinations of cash plus the parenting or the health and nutrition can be designed well. So try to do that very mindfully and in a structured fashion, while ensuring fidelity and implementation so that we know what it is we're actually evaluating, but take advantage of those opportunities to affect change and to learn from the experience.
Well, thank you very much for the listeners and for this wonderful presentation. I think we have to remind ourselves that really what our goal is to promote healthy development and to assure an enabling environment for families. So thank you and have a good day.
Thanks.
Press here.